You know, there's a fascinating paradox in surgery where sometimes going bigger, doing a more extensive operation, is actually the safest bet for the patient. It's this high stakes game of risk versus reward. And today we're going to break down exactly why that is. So picture this. A surgeon finds a tumor. The next decision they make, which specific operation to perform, isn't just a technical detail. No, it's a choice that can completely change that patient's future, their chances of survival, everything. And that brings us to the core of our story today, a huge dilemma that revolves around one tiny little gland. We're talking about the thymus. It's this small but really important gland tucked away right behind your breastbone. It's a key player in your immune system, but like any part of us, it can sometimes develop tumors. And here is the absolute crux of the problem. Before the surgery even starts, it's incredibly tough for doctors to know for sure what kind of tumor they're dealing with. Is it a slow-growing type, a thymoma? Or is it a much more aggressive, dangerous cancer called a Thymic Carcinoma? You just can't be certain. And just how uncertain are we talking? Well, get this. A key study found that a staggering 79.3% of tumors that looked early stage on scans, well, they turned out to be more advanced once the surgeons actually got in there. Almost 80%. That is a massive margin of error to be working with. So this is the million-dollar question, right? If you can't be sure what you're up against, what do you do? Which surgery is the right call to give the patient the best possible shot? Now, for a while, the big trend in medicine has been all about less is more, which brings us to the very real allure of doing a smaller surgery. Okay, so you've basically got two options on the table. On one side, there's a partial thymectomy. You go in, you take out just the tumor. It's less invasive, and it sounds like the perfect choice if you think the tumor is benign. On the other side, you've got the total thymectomy, where you remove the entire gland. It's a much bigger deal, but it's the gold standard for a known cancer. You can see the appeal of the smaller option, can't you? Why do more than you have to? Or, is there more to the story? Well, to answer that, we have to look at the cold, hard evidence. And thankfully, a landmark study put these two approaches head to head. So a group of researchers in Japan dug into real-world data from 92 patients who had that aggressive thymic carcinoma. It came from 19 different hospitals. Now, most of them got the full surgery, but a smaller group of 19 had only the tumor removed. And this setup was perfect for comparing the outcomes. And the results? Well, they speak for themselves. Just look at this graph. It shows the 5-year survival rates. For both overall survival and the chance of the cancer coming back, the bar for the partial surgery group is way, way lower. The visual evidence is just, it's undeniable. And the numbers absolutely back this up. That difference in overall survival, it was not a fluke. The p-value here is 0.0027. In simple terms, that means the result is statistically significant. There's almost no chance it happened randomly. Patients with the partial surgery genuinely had worse survival rates. But wait. It gets even more dramatic when you look at the cancer returning. Here, the p-value is less than 0.0001. I mean, that is an incredibly powerful statistical signal. It means the smaller surgery carried a massively higher risk of the cancer coming back. It's a huge difference. So all of this data is pointing to one very clear conclusion, one that might feel a little counterintuitive in this age of minimally invasive everything. Why bigger is actually safer. So let's just break down the logic here, step by step. 1. We know you can't trust the pre-surgery diagnosis. 2, we've just seen the evidence that a partial surgery is flat out dangerous if that tumor turns out to be cancer. So, what's the only logical conclusion? 3, the total surgery has to be the safest default choice to give every single patient the best shot at a cure. And the authors of the study really hit the nail on the head. They concluded that a total thymectomy is, and I'm quoting here, oncologically superior. They say it should be the standard of care unless, and this is a huge unless, a doctor is 100% positive before surgery that the tumor is benign. A level of certainty that, as we've seen, is pretty much impossible to get. Now, a finding this powerful doesn't just stay in a medical journal. This is the kind of evidence that really starts to change the standard of care for everyone. And this wasn't some one-off study either. This table shows that other recent analyses are all pointing in the same direction. One found worse survival with partial surgery, another said the evidence supporting it was very low, and a third found a shocking drop in 5-year survival from 67% with a total removal down to just 30% with a partial one. The consensus is building, and it's strong. So, the takeaway for the entire medical community is crystal clear. This isn't just a theory, it's solid, real-world evidence. It's sending a powerful message that if you want the best possible cancer outcome, a total thymectomy is simply non-negotiable. And that leaves us all with a final, really important question to think about. We're living in this exciting time where the push is always for smaller, newer, less invasive procedures. But a case like this is such a powerful reminder. How do we make sure we're always choosing not just what's new, but what's actually right for the patient? Our deep dive today was based on the profound and insightful review by Dr. Reza Lankarani, who is also an editorial board member of the Genesis Journal of Surgery and Medicine. If you want to get into even more of the details, you should absolutely check out the Surgical Pioneering podcast series application. The link is right there on your screen. Thanks so much for digging in.